Welcome to the finale for the 2026 Bring It Learning Series, Turning Health Policy Insights into Action. I'm Carson DeWeese, and I'm going to be your main guide today, and I'm also the communications assistant here at the Kansas Health Institute. So, KHI, or the Kansas Health Institute, is a nonprofit, nonpartisan educational organization based in Topeka, and we were established in 1995 with a multi-year grant from the Kansas Health Foundation. And we are guided by the vision that Kansas will become the healthiest place to live through evidence-based and innovative strategies, policies, and practices. We work towards this vision by providing nonpartisan information, convening crucial conversations, and facilitating learning that leads to meaningful change. If you visit our website or you stop by our building, you'll see that our work involves research, evaluation, technical assistance, and policy analysis, as well as podcasts, blogs, and gatherings like today's convenings. All right, so welcome to today. Let's go through the agenda. We will first have our welcome and framing time, where we're going to go over the purpose of today's session. Then we will do a quick overview of the entire Bring It Learning series to remind everyone of the 4 previous sessions. After that, we will split into 4 breakout rooms where you will all participate with the subject matter expert discussing one of the themes that was discovered from their specific Bring It session and informing each other about what work is being done in your circles. After that, we will come back together and Val will lead us through a whole group harvest where we hear about each breakout session as well as a closing reflection to wrap us up. So, to frame today and the purpose of today's session, let's talk about what we're going to be doing. It's a participant-driven conversation, so we're going to encourage you guys to give your input as we go into the breakout rooms, either in the chat or even coming off mute if you're comfortable doing so. These breakouts will create opportunities to share perspectives, surface key questions, and explore ideas for action or collaboration. They will be grounded in themes from the Bring It series with a focus on shared interests in your communities. We are hoping for you to teach each other, share resources, and enjoy a collaborative learning experience. Facilitators will have theme options specific to their topics, so choose your room based off your own work and interests. And just to reiterate, we're looking to create a productive and respectful learning environment. So as we move through our hour together today, please remember our community agreements that will help us stay connected, respectful, and able to follow the conversation as a group. So for our Bring It overview of what the previous 4 sessions have been, our first session was February 10th, and it was over federal rural health funding in Kansas. During that session, participants learned how federal funding opportunities can support rural health access, care, delivery, and system sustainability, and what they may mean for Kansas communities and state policy discussions. Our second session occurred on February 17th, and that was the health insurance marketplace changes in 2026. During that session, there was an overview of premium trends, insurer participation, and how different households may be affected. Participants heard from a panel about what these changes mean for access to care and service delivery across Kansas. Our third session, which happened February 24th, was Understanding OBA, or HR 1, and its impacts on Medicaid and CHIP in Kansas. During that session, we had an overview of key OBA provisions affecting Medicaid financing tools, enrollment and eligibility rules, and incentives for expansion. Participants learned how these federal changes may impact access to care, how the state administers the program, and policy discussions within Kansas. And just last week, on March 3rd, we had our 4th session, Learn How to Host a Hunger-Free Kansas Data Walk. During this session, a presentation and panel discussion about the Hunger-Free Kansas Data Walk posters occurred, and practical tips and tricks were provided for both planning and facilitating a data walk within communities in Kansas. So we're going to be directing you guys into your breakout sessions with your different groups. So pick your room based on whatever topic you're most interested in or have questions on. We will give you a couple of moments to transition to your rooms, and then each subject matter expert will get started.
Welcome back, everyone. My name is Valentina Blanchard. I'm an analyst with KHI, and I'll be leading us through our reflection in our closing. I was able to bounce around the groups a little bit. So if you saw me pop in and out, and it sounded like there were some really great conversations. So let's hear from each of our breakout groups. We'll have each group share things from their conversations, one key insight, one open question that they're leaving with, and one thing to watch. So whether that's a challenge or a tension that's worth naming, or an opportunity that deserves lifting up. And as a note, these are four very distinct topics, so we're not expecting to kind of connect things across groups. But as you're listening to our facilitators share out, I really encourage everyone to listen with the three things in mind that are on the slide. So the common challenges, are there barriers that are showing up across these groups, even though these are different topics? Shared questions, are there questions that seem to cut across the work? And emerging opportunities, really, where does the energy seem the highest for these topics? So I'll start with Shelby from our rural health group. Go ahead.
Thank you so much, Val. We had an excellent discussion and I was typing furiously. So I'm going to try to really summarize some of our high level points here. So the key insight that I wanted to highlight, we talked a lot about how rural communities can engage together to pursue funding opportunities and really leverage federal funding. I think one thing that we all consolidated around was the idea that the best ideas for how Kansas can support rural communities need to come from Kansas. They really can't be transplanted in. They need to come from the communities that they serve, and that's really important when we're thinking about not only pursuing funding but also using the funding that we have available at the state and local levels. One open question, and I really enjoyed this question, was what does leverage rural health funding opportunities mean? So we talked a lot about, does that mean getting more funding? Does that mean using our existing funding differently? What can that look like? And then one thing to watch, we did talk about different aspects of the Rural Health Transformation Program. One area that I was surprised to hear a lot about was aging and how the Rural Health Transformation Program incorporates aging within its focus areas. So I think that's one thing we'll all be watching. So I'll turn it back over to you. Thank you, Val.
Awesome. Thanks, Shelby, for sharing. Yeah, that was a very robust conversation when I jumped in. Cynthia, for the marketplace discussion.
Sure, thanks. So we had also had a great conversation, and we focused a lot on issues of access and coverage, and then also uh, how to improve health literacy because those seem to really go well together. And part of the conversation was just practical of which paperwork do you bring, how do you sign up, and those kinds of issues. And I think behind it, a lot of it was that you're on your parents' insurance often and can be up until you're 26. Then you go to employer, you have limited options from your employer, so you're really not having to make the kind of decisions about what you need from your insurance and what are the costs and what kinds of care and what medications and all those kinds of issues that become really important when you're trying to select private insurance not through your employer, so through the ASA, for example. Another key theme I thought was really important was health literacy capacity isn't just for the consumer. So it's not about asking the right. It is important to ask the right questions, but it's not just about that. It's being able to get the right answers. So, what are the health literacy needs of the providers and the navigators so that they can answer the questions that you have as a consumer, in addition to the things that you need to know as a consumer. Um, those were kind of our best themes in terms of kind of an open question. Is it an educational issue or is it a community issue? So what addresses health literacy? So that was I think our question that we would have liked to gotten to the bottom of. And there's just a lot of things to watch as things in the marketplace and the whole insurance industry change. We'll keep watching.
Awesome. Thanks so much, Cynthia. Sheena for our Medicaid group.
Thanks, Val. Yes, so we had a great discussion as well. One key insight I wanted to share is that we discussed potential federal changes and their impacts to Kansas related to the One Big Beautiful Bill Act in our session. And I think one of the insight is that we kind of were able to discuss what the legislation does and what it doesn't do in Kansas. So whether that's work requirements not applying to a state like Kansas because it hasn't expanded Medicaid, or some of the more stricter eligibility requirements only applying to expansion populations. We were able to kind of discuss that that piece. One thing that we did discuss was retroactive coverage changes that will apply to Kansas starting in 2028. It'll go from 90 days to 60 days. And then we shifted our conversation more to one open question, which is state legislation that is making its way through the legislature. SB 363, which would make some changes to the Medicaid program. It passed the Senate and is now being considered by the House. And that would require quarterly eligibility redeterminations for the Medicaid population. It would also make some changes to the SNAP program. And so, one open question individuals had in our group was, what will be the status and how will that impact the program if it passes? And also, kind of, what is the stance of the state government or the administration on this bill, and how can they find out more information? So that's something that we'll continue to watch and kind of understand if it does pass, what impacts it will have in addition to the federal legislation that we discussed today. And so that's one open question, and also our one thing to watch.
Awesome. Thanks, Sheena. And last but not least, Victoria with our Hunger Data Walk group.
Hi, everyone. So with our Hunger Free data group, a key insight that we talked about is that Hunger Free Kansas and just the data walk model can be used across many different sectors. We can see that it can be used across like county initiatives as well as nonprofit work. So we talked about how we can mold this exercise for unique partners. And at the end, we did encourage these partners to leverage diverse voices and leaderships and participants to engage in conversations for each event. Some questions that we had was mostly targeted towards how to carry out the facilitation of posters to any audience, and how do we not treat it like a traditional presentation successfully. So basically how to encourage participation, especially like if there is no formal experts nearby the data. How do we give our partners everything they need in order for it to be a successful event and they can get something out of it? Something else that we are looking forward to is that while we know that data walks are in established models, but is there room for innovation? And can we mix strategies together with different exercises or use novel tools like one we talked about was photo voice into the data walk process? So those are the things that we talked about.
Awesome. Thank you so much. And thank you to each of you for participating in your breakout group and facilitators for facilitating those and really having those open conversations. Again, I was able to jump around some of the groups and hearing these report outs, a few things are kind of standing out to me, and there's a clear theme, it seems, around the importance of grounding solutions in the local context, that the answers need to come from here, from Kansas, and from the communities and those people that are most affected. And I also heard some really honest questions that were raised about the language that we're using and what that actually means for practice. So terms like that leveraging resources or navigating the system, and reminder that the organizations that need to stay connected to the people who are actually using those resources that they offer. I also heard several of the groups name some challenges with keeping up with the information and changes that are coming out really fast, and the reality that there is still a lot of unknowns, and doing the meaningful work that you all are doing in the middle of that really takes significant commitment. I also heard a thread about the complexity and what it takes for people to navigate systems, and especially when they haven't had to do that before. and the idea that building that knowledge and preparation more intentionally really felt like an important conversation. And like Victoria said with the photo voice, I heard a lot of really exciting things about the future, peer-to-peer learning through tools like photo voice, which I just learned about today, new ways of sharing knowledge across communities. And what this group work has really shown me is that there's a lot of significant work that's already happening across each one of these areas. Obviously, these are not starting from scratch conversations, and there's people in this room in the field that are really already doing that hard work. So I hope today was a chance to surface some of that and learn from each other and think about where to go next. Obviously, each group named questions that they're still sitting with, and that's kind of the point of this as well. It means that people are still engaged and paying attention, and that there's still some good work to do. So before we close out completely, I want everyone to give everyone a moment to reflect individually as well. So you'll see two questions on the screen. I want you to choose the one that resonates the most with you, and just take a moment to think and then share your response in the chat. Or, we can have a couple people come off mute if they'd like, just a sentence or two. So option A is, what is one thing that shifted your thinking today? And option B is, what is one conversation you want to continue after today? And if you'd like to answer both, that's great too. Got someone excited to start planning their data walk. That's great. Continuing conversations about funding opportunities, especially in rural areas. Conversations on how we can be proactive versus reactive with all the quick changes that are happening, especially as the legislative session is wrapping up in the next couple weeks. Continuing engagement and participation of local health departments through the Rural Health Transformation Program. That's great. Thank you. Keep those coming in. But I will turn it back over to Carson to close us out for today.
Thank you, Val. And thank you to all of our facilitators who also helped out today and for the entire Bring It series. We would really like to make sure that we continue to design convenings that are meaningful for all of you. So even if you have taken a survey previously for the Bring It series, please click on the feedback survey link that's going to be put in the chat or scan the QR code on screen to provide your thoughts and feedback about today's event. Here's yet another QR code, and we're providing a link directly to the Bring It series website. You can access all of the information that we've provided throughout the series on that site. So if there's anything that you've missed, any resource guide or anything like that that you still need, make sure you scan this QR code or access the link provided in the chat for this one. Next, we cover a wide range of topics, which has been shown in our Bring It Learning series, and there's plenty more that we haven't even covered that KHI provides. So head on over to our website, khi.org, to find podcasts, federal policy updates, recent publications, and a whole lot more. Thank you again for attending the Bring It Learning series. We hope to connect with you more in the future, and we hope you all have a wonderful day.